So, when we talk about the history, 1954 marked the history of discovery of benzodiazepine by Sternbach. Then as he was doing the studies, he wanted to introduce it to clinical use in only 1963 with diazepam. In between, lorazepam or the chlordiazepoxide, which is a longer acting diazepam, found its way into clinical medicine. However, the various metabolites of diazepam started being used and tried in clinical anesthesia between the 1960s to 1970s are the oxazepam, the oxymetabolite of diazepam, the lorazepam, it is a 2-chloro substitute of oxazepam, and of course, the real breakthrough is with midazolam by Fryer and Walser in 1976. This is a water-soluble drug wherein the imidazole ring replaces the methylene ring of diazepam, the methylene side chain if you call it. So, now phase 3 trial we are having remimazolam. It is an ultra short acting drug. It has got a large volume of distribution, and another important thing is it's a very short half-life. So it is it's almost we can call it a wonder drug. It is being put into clinical use now. So when I say about benzodiazepine, these are all the drugs, an overview of them. This is diazepam. The diazepam, the lorazepam, tamazepam, all of them have a methylene side chain attached to this imidazole ring. This is a imidazole ring. And then, whereas in midazolam, that is replaced, this is another extra ring there, this imidazole ring. So what happens is, this is an open ring which makes it water soluble, and then once it reaches the biological pH inside the body, it becomes a closed ring, and that liposolubility, the lipid solubility increases. So the CNS penetration is better, as also the volume of distribution. So it is very, very useful. Of course, lorazepam is a very long acting drug. So it is mainly used for longer surgeries like cardiac anesthesia, because all these benzodiazepams, they produce an anterograde amnesia. What is anterograde amnesia? That is, whatever happens inside the operating theatre. Supposing you pre-medicate a baby or an adult with benzodiazepine, after the drug starts acting, what happens is, from that time the drug is acting till about an hour or two, depending on the drug's efficiency, the patient forgets what happened. So, a child is given a pre-medication with benzodiazepine or midazolam, and then if the child is taken inside the operating room, the child will not have the memory of the stress of the operating room with so many ceiling, all the shadowless lamps or the monitors and other things. So, it is very, very useful that benzodiazepines, it is a very, very important advantage of using benzodiazepines for pre-medication. However, flumezanil is just, it is a benzodiazepine, no doubt, but it has got a carboxy methyl ester link in the side chain. So that makes it lose its intrinsic benzodiazepine activity. That is why it is flumezanil. As the word says nil, you can remember there is no benzodiazepine related sedation or amnesia or hypnosis with flumezanil. So this is about a short brief description about the structural formation of the various chemical drugs we use in the group of benzodiazepines in clinical anesthesia. So what are all the applications? Generally, they all act on the GABAergic system in the brain. Also, there are some peripheral benzodiazepine receptors. However, the GABA-A receptors, they are the key mediators of the actions of the benzodiazepines, and they are mainly predominantly anxiolytics, sedatives and hypnotics. the alpha 2 and the alpha 3 subunits of the GABA. As you all know, the GABA has 18 subunits and on the receptors, 6 of them, the pentameric or the hexameric receptor, they are mainly acted upon by they mediate the anesthesia part of the GABA A receptors. However, the other receptors, because of their action on the other receptors, the GABA, they also have addiction liability. And midazolam is the best for pre-induction of anesthesia. And the future lies with remimazolam, which is an ultra-short acting GABA receptor agonist drug. So, they are all very small lipid soluble molecules at physiological pH, so causing a rapid CNS penetration and a large volume of distribution in steady state. However, the midazolam contains an open imidazole ring. It offers it to be a water soluble agent. So, the irritability, irritation, thrombophlebitis, all that they are such as undesirable side effects are overcome. And this water soluble buffer is an acidic pH. That drug, when it is going into the blood and because of the alkaline pH of the blood, ring closes and that becomes more lipophilic. So, the imidazole ring of midazolam accounts for the stability in solution, that is the open ring, and the lipophilicity due to the rapid closing of the ring at the physiologic pH. This is what you all should know, how midazolam acts as a rapid onset.